Hi, today let's talk about self-breast examination. So now a new term is coined saying self-breast awareness. So it's important for every woman to be aware of the changes that is occurring in her body, and it's very important to identify if there are any changes happening in her breast as early as possible, because early detection of various conditions pertaining to the breast can be treated as easily. So it's important that they do a breast examination every alternate day. So most commonly women ask is like, from which age are we supposed to do breast examination? Is there any particular day in the month that we should do the examination, or how regularly should we get a mammogram done? Let's answer all those questions. So usually if you're a woman in the menstruating age group, then you'll have to do a breast examination on the day 5 to day 6. Those are the days when the hormonal cycle or the hormonal milieu is normal, and when you do it, there's always a comparative scale, and those are the best days to do it. And also, if you are a woman who belongs to the age group of 50 or more and you've stopped menstruating, you can do your breast examination any day of the month. Initially they used to say you can do a breast examination every other day. Because of recent studies, it's found that you can do examination every alternate day, and if you find any discrepancies or if you're able to palpate a lump or a swelling, it's important that you meet a doctor as soon as possible. So how do you do the breast examination? Which position do you do a breast examination? So the first most important position is stand in front of a mirror. Make sure that you raise both your hands up and then examine both your breasts. If both the breasts are in the same size, if there's a swelling in one breast or slightly engorgement in one breast, if you're able to appreciate or see the nipple areola complex, if you are able to pick up any sort of pigmentation or any difference in the skin texture in those areas, it's important to note that. And it's important also to see if the nipple is in the right location, or if there is if the nipple is pulled up or pulled down, or if the direction of the nipples are slightly altered. It's important to note that as well. So examination, that is observing them, is more important. So stand in front of the mirror with your hands up and start examining how your breasts are appearing. If the appearance of your breasts are pretty normal, then you go to the next step where you examine your breast. So examining your breast is best done when you're taking a shower, because applying a little bit of soap to the breast as well as your hands will increase the sensitivity in the breast, and it will also comfort you. So might as well do it when you're taking a shower. So after applying a little bit of soap, make sure that you use your 3 fingers and use the pulp of your fingers and not the tip of your fingers to examine. So most women commonly examine with the tip of their fingers or start holding their breast tissue. So when you start palpating your tissue, like holding them, you tend to feel that there is some sort of like a swelling or a lump, even though if there's nothing existing there, because the entire breast is made up of a lot of glands, with the glands which supply directly to the which have ducts and which leads to the nipple. So when you start holding the glands, or when you start holding the breast tissue as a lump, you tend to feel there is a swelling. So do not hold the breast tissue, or do not use your tip and start poking your breast. Make sure that you use the pulp of your fingers and start examining outward to inward in circular motions. So you do circular motions from the outer quadrant and keep going inside, and also palpate on top of the nipple areola complex and palpate all around and inward towards the breast. So once you don't feel any lump or any swellings, or you don't feel any discoloration, or you don't find a significant tenderness or a pain, then you're all good to go. Make sure that you examine the next breast after. So while you're examining this, if you're examining the right breast, then your right hand should be lifted up, and then you should palpate with your left hand. If you're palpating the left breast, then your left hand should be up and you palpate with the 3 fingers of your right hand and start palpating. So once you palpate and you are feeling that there's nothing that you can find and everything is normal, then you're all good to go. But if you find any sort of discomfort, you're feeling a pain or a tenderness, or if you feel there is a lump or there's a smaller lump that you're not able to clearly identify, please meet a doctor as soon as possible. So a lot of women tend to get extremely scared, and they think that when they have a small breast pain or they have a tenderness, they immediately associate it with a cancer of the breast, and they can tend to get very scared. So the first most important thing you should know is breast cancer is usually associated with painless lumps, which means you will have swelling but there will be no pain at all. And again, normal lumps without any pain can also be fibroadenoma, which are normal swellings in the breast. So it can be fibroadenoma of the breast, which are just normal lumps which are found in the breast, which will not be malignant or will not have an intention to become a malignant lump as well. So do not panic or do not get extremely anxious. Make sure that you meet a doctor and get the next set of tests done to confirm what sort of a lump or a swelling it is, and then what are the treatment options available for the same. So who are the women who need to do a self-examination? So women belonging to the reproductive age group, perimenopausal age group and menopausal age group all have to start doing a breast examination every alternate day. It's important to get an annual breast examination done by a gynecologist or an oncologist. If you have any of your family members either having a breast cancer, uterine cancer, ovarian cancer or intestinal cancer, it is very important for you to meet a doctor or a gynecologist and make sure that you get, if you're above the age of 40, to get a mammogram done, if you're below the age of 35, to get an ultrasound breast, and keep following it up regularly, because it is a genetic condition where breast cancer is a genetic condition and you tend to miss out on the early stages. So it's important to keep screening yourself and make sure that you do not have any symptoms or any lumps suggestive of CA breast as early as possible. So if you do not have a familial history, you don't have anyone having any conditions pointing towards CA breast or ovarian cancers or uterine cancers, then you can at least do an annual breast examination, an annual ultrasound breast, and if you're above the age of 40, to get a mammogram done. So everything said and done, anyone who's feeling a lump which is painful, painless, small or big or hard or soft, you have to meet a gynecologist or you have to meet an expert and make sure that you get it diagnosed and make sure that you've done the right diagnostic modality to find what sort of a lump it is and get it treated as early as possible. Because breast cancer is the most common cancer which is present in India at this point of time, and it's detectable very, very early. So if you have any signs and symptoms suggestive of that, like nipple discharge, or you have a discoloration on your breast, or if you have a breast engorgement, or if you're having breast pain, please do meet a doctor and make sure that you know what is the condition that you're suffering from.